Cyclobenzaprine is a skeletal muscle relaxant that works on the brainstem to treat muscle spasms of local origin. In this video, let's found. What is cyclobenzaprine? What is cyclobenzaprine used for? Contraindication. What are the side effects of taking cyclobenzaprine? How does cyclobenzaprine work? How to use cyclobenzaprine? What is cyclobenzaprine? Cyclobenzaprine is a muscle relaxer used for muscle spasms from musculoskeletal conditions of sudden onset. It is not useful in cerebral palsy. It is taken by mouth. Use is not recommended for more than a few weeks. Common side effects include headache, feeling tired, dizziness, and dry mouth. Cyclobenzaprine was approved for medical use in the United States in 1977. It is available by prescription as a generic medication. In 2020, it was the 39th most commonly prescribed medication in the United States, than 16 million prescriptions. It was not available in the United Kingdom as of 2012. What is cyclobenzaprine used for? Cyclobenzaprine is indicated as a short-term, 2 to 3 weeks, adjunct therapy, along with rest and physical therapy, for relief of muscle spasm associated with acute, painful musculoskeletal conditions. It has not been found effective in the treatment of spasticity originating from cerebral or spinal cord disease, or spasticity in children with cerebral palsy. Cyclobenzaprine is also occasionally used off-label for reducing pain and sleep disturbances in patients with fibromyalgia. Contraindication. Cyclobenzaprine is contraindicated for patients known to have hyperthyroidism, myocardial infarction, the acute recovery phase, arrhythmias, heart failure, heart block or conduction disturbances. 14 days of taking a monoamine oxidase inhibitor, MAOI. What is cyclobenzaprine used for? Cyclobenzaprine is indicated as a short-term, 2 to 3 weeks, adjunct therapy, along with rest and physical therapy, for relief of muscle spasm associated with acute, painful musculoskeletal conditions. It has not been found effective in the treatment of spasticity originating from cerebral or spinal cord disease, or spasticity in children with cerebral palsy. Cyclobenzaprine is also occasionally used off-label for reducing pain and sleep disturbances in patients with fibromyalgia. Contraindication. Cyclobenzaprine is contraindicated for patients known to have hyperthyroidism, myocardial infarction, the acute recovery phase, arrhythmias, heart failure, heart block or conduction disturbances. 14 days of taking a monoamine oxidase inhibitor, MAOI. Mechanism of action. The exact mechanism of action of cyclobenzaprine has not been fully elucidated in humans, and much of the information available regarding its mechanism has been ascertained from early animal studies. There is some evidence that cyclobenzaprine exerts its effects at the supraspinal level, specifically in the locus coeruleus of the brainstem, with little to no action at neuromuscular junctions or directly on skeletal musculature. Action on the brainstem is thought to result in diminished activity of different alpha and gamma motor neurons, likely mediated by inhibition of coeruleus spinal or reticulospinal pathways, and also depressed spinal cord interneuron activity. More recently it has been suggested that inhibition of descending serotonergic pathways in the spinal cord via action on 5-HT2 receptors may contribute to cyclobenzaprine's observed effects. Half-life. The effective half-life of cyclobenzaprine in young healthy subjects is approximately 18 hours. Dose. Muscle spasm. Immediate release tablet. 5 mg, POQ8HR. May increase dose to 7.5 to 10 mg, POQ8HR, PRN. Extended release capsule. 15 mg, POQ day. Some patients may require up to 30 mg, POQ day. Safety advice. Pregnancy Category B, reproduction studies have been performed in rats, mice and rabbits at doses up to 20 times the human dose, and have revealed no evidence of impaired fertility or harm to the fetus due to Flexeril. There are, however, no adequate and well-controlled studies in pregnant women. Dose. Muscle spasm. Immediate release tablet. 5 mg POQ8HR, may increase dose to 7.5 to 10 mg POQ8HR PRN. Extended release capsule. 15 mg POQ day. Some patients may require up to 30 mg POQ day.